Today, we have 8 additional people who have tested positive for COVID-19 in British Columbia, bringing our total to 2,783 people in BC. And that includes 950 people in the Vancouver Coastal Health Area, 1,441 in the Fraser Health Area, 130 people in the Vancouver Island Health Region, 197 people in the Interior Health Region, and 65 people in the Northern Health Region. We have no new healthcare-related outbreaks, leaving us with 7 active outbreaks right now, 6 of which are in long-term care and 1 in acute care. Additionally, we have 588 people associated with our acute care or long-term care outbreaks. That includes 365 residents and 223 staff. There are no new community outbreaks, and we have 1 additional outbreak that has now been declared over. That's the one that was at Nature's Touch facility. So that's good news. And we continue to monitor and support the other 3 remaining locations where we have community outbreaks. I do want to say that one of our new cases reported today is an adult who is connected with an independent school in the Fraser Health Region. Public health teams have investigated and they are continuing that investigation, but a small number of close contacts have been notified, and no children have been involved. And as a precaution, the school has stopped their in-class learning for the balance of the year. Given that we still have spread of COVID-19 in our communities, this is not surprising, and it is something that we were preparing for and monitoring as children went and teachers and educators went back to in-classroom schooling at the beginning of the month. So we now have 190 active cases in the province, of whom we have 10 people in hospital, 5 of whom are in critical care or ICU. Again, today we have no new deaths of COVID-19, and 2,425 people have now fully recovered from the disease. As you're aware, yesterday we reported a new outbreak at the Mission Memorial Hospital and a related one at the Tabor Home long-term care facility in Abbotsford. And so those 2 facilities, along with the one announced the day before, the Maple Hill long-term care facility, are all linked, and we now have a public health team from Fraser Health who are working actively in all 3 sites to ensure that a detailed investigation has begun and that all of the appropriate measures have been taken to contain any possibility of spread. We are monitoring it very closely, and they continue to have an on-site team to ensure that we have all of the infection prevention and control measures in place and that testing and screening is being done at all 3 facilities. As these new healthcare outbreaks demonstrate, this virus can quickly spread and often undetected, and that is the challenge that we face, is that we can have very mild illness or early on in the illness or just before symptoms start. People may not know that they are infectious to others, and this can lead to multiple cases in multiple locations very quickly until it's recognized. This is a challenge that we will continue to face for the foreseeable future. We have done an amazing job here in British Columbia bending our curve, but we have not yet, and nor is it likely that we'll be able to eliminate the virus completely from our communities in the near term. I've said this before, and it continues to be incredibly important for all of us, whether at home, at a family event, at work, at school. We must continue our vigilance, and we must continue to monitor ourselves for even mild symptoms, and always, always stay home. Stay away from others, stay home from work, stay home from school. Even if you are an essential worker, stay home if you are even mildly ill right now and get tested. You can be tested anywhere in the province. You can call 811 and you can have, and they will direct you on where you can get that done. We also know, and these recent outbreaks highlight to us, that our seniors and our elders are the most vulnerable to serious illness from COVID-19. And we know that here in BC and around the world. And this is why the precautions that we have in place in long-term care facilities, where we know the conditions are such that if the virus gets into those settings, it can spread undetected very rapidly, and that has led to so much of the tragedy that we have seen with deaths from this virus. We understand that the restrictions on visitors in particular comes at a very high cost, both for the residents and for their families and loved ones. We know how hard this is. Every person who enters a facility increases the likelihood that this virus may enter with them, regardless of the safety precautions that are taken, and we need to take that into account. It is really the terrible challenge that we are facing right now, and that is why it is so important that we continue our vigilance in the community to reduce the risk of this virus as much as we possibly can. Our approach has and will be to move forward slowly with caution, and we do believe that, like many parts of our economy and our province, we will be able to modify our approach and ease those restrictions on visitors and on people going in to support our elders and seniors when it is safe to do so. So whether at work, out shopping, out visiting a friend, using all of the layers of protections that we've learned is the best approach and the approach that we need to continue to take. So that means maintaining our safe physical distance from others, fewer faces and bigger spaces so that we don't give this virus a chance to spread. Using barriers, those are very effective in those places where we do need to get closer to others. Having clear policies for employees around making sure that we're not sharing space together in lunchrooms, in other parts of our work settings. And as a last measure, of course, using a non-medical mask for those times when we can't always consistently maintain our safe distances. Along with the other things that we also know, things like cleaning our hands regularly, cleaning our spaces, and keeping our bubbles small. Our strength and our safety is in using these multiple layers to keep COVID-19 low and slow and reduce its impact on our families, our communities, and our loved ones. To do that, let's continue to work together, to take care of each other, and each of us do our part. And we need to continue to do it in the spirit that we have for the last few months. Do it in the spirit of kindness and calm, and let's all be safe.